Good morning. Good morning. I'm Helen Nafula from the Organization of Den of Hope. We are located in Sydney.
Good morning. My name is Phoebe Ongadi from KENCO. KENCO is the Kenyan Network of Cancer Organizations.
Good morning. I'm Tommy John from the National Taxpayers Association.
Good morning. My name is Answa K from NCD Alliance Kenya. NCD Alliance Kenya is a body of civil society organizations dealing with non-communicable diseases.
Yeah, good morning, everyone. My name is Thomas Lindy from the Kenya Tobacco Control Alliance. Today we have a statement that we would like to share with the public, the fourth estate. Our subject is we advocates, we support calls for strengthened tobacco control measures in Kenya. In a unified effort to stop the 9,000 deaths linked to tobacco every year, and the growing incidences of disease linked to tobacco, such as heart disease, cancer, diabetes, we, a coalition of tobacco control advocates led by the National Taxpayers Association, we fervently support the review of the Tobacco Control Act 2007 and the regulations of 2014 that are aimed at curbing illicit narcotic drugs. So for them that are not aware, right now there is a meeting that is going on in Naivasha of tobacco control advocates. They are looking at reviewing the Tobacco Control Act, which is the law that regulates all the tobacco control products in our country. As stakeholders, we are coming out strongly and we are saying that we support that process. This collective endeavor aims to reinforce the nation's commitment to reducing tobacco and nicotine products affordability, curtailing tobacco industry's influence, and fostering transparent and inclusive policy-making processes. It must be noted that Kenya civil society organizations were key players during the WHO FCTC ratification and the subsequent the enactment of the Tobacco Control Act of 2007. To date, they have actively played a pivotal role in supporting government tobacco control efforts, as well as fostering government accountability. In a nutshell, what we are trying to say is that the tobacco control laws in Kenya are beneficial for our country. And over the years since 2007, we have seen the number of tobacco users going down. And we need the government to do more so that we continue protecting more of our women, more of our children from being affected by this product. So furthermore, the regulations will ensure to stop the early onset of tobacco use by children and young adults. According to WHO news release, the usage rate of e-cigarettes among children 13 to 15 years are higher than adults in WHO region. So in short, we are just trying to sound an alarm that the usage of tobacco products has been high among the age group that are more vulnerable, the young children. So we want our government to do more so that we continue to protect our people from the diseases associated with such products.
Curbing tobacco use has failed, principally because of the current tax system. So as you all know, Kenya, with the changes in law, currently has a two-tier system of taxing tobacco, which is based on filters. And actually what the industry did, because to some extent, the tobacco industry influenced the review of the law, which made the tobacco to be categorized into two, which is filtered and unfiltered tobacco. Well, in this case, it is quite unfortunate that even when it comes to consumption of such products, we have a category of those who are well off can procure filtered tobacco, and those who are not well off can procure the unfiltered tobacco. So, and 35% excise tax, which is extremely low as compared to WHO recommendation of 70% of recommended retail price, and is among the lowest in the world. WHO's evidence shows taxing tobacco products is the most effective way to reduce consumption, thus reducing diseases such as cancer, diabetes, and heart diseases. According to the WHO's Framework Convention on Tobacco Control, which Kenya is a signatory, tobacco taxation can contribute to prevention of 9,000 deaths every year. By leveraging tax policies to elevate tobacco prices, Kenya can render tobacco less accessible to children and young people, thus discouraging consumption and safeguarding public health. Since 2023, the momentum of the review of Kenya's Tobacco Control Act and regulation has steadily gained traction, signaling a pivotal moment in the nation's journey towards a healthier tobacco-free future. The latest calls coming from the Ministry of Health and Ministry of Interior and National Administration. This is another opportunity to ensure that our tobacco control policies align with public health objectives of reducing consumption of tobacco products. And actually, this is one of the main reasons as to why we are doing this press, because as civil societies within the tobacco control advocacy, we feel that this is a golden opportunity to both the government and us as civil societies and any other stakeholder other than those who pretend to be also stakeholders, and I believe you know them, feel that it's an opportunity for us to make right and also to improve on the existing laws that govern the tobacco consumption within our jurisdiction. So with that, the key demands and position of our campaign is as follows.
Number one, we want affirmation of support for the review. So together, unequivocally, we express our support for the comprehensive review of the Kenya's Tobacco Control Act of 2007 and Regulation of 2014, recognizing the evolving landscape of tobacco use and the detrimental impact on public health. And as you know, public health concerns right now is on the non-communicable diseases, especially cancer, which is currently the number 3 leading cause of death. And there are 16 cancers that are directly linked to tobacco. So we advocate for robust measures to strengthen existing legislation and enact new provisions that align with the international best practices. And currently what we are seeing, emerging tobacco and nicotine products such as the velo, which is very common among the young people, should be banned. Other products of tobacco should also be a high-resolution graphic images to show their true impact, not the tiny or the microscopic writings. We want them to have the high resolution images to show especially the impact directly on the public health of the young people and the persons who consume them. They can cause, for example, abortion, just to mention but a few, damage the developing brains of children and adolescents according to the WHO. Additionally, promotion and sale targeting children through social media and influencers should also be considered during this very important review. So we are calling number 2 for inclusivity and transparency in this process. We are urging stakeholders involved in the review process to prioritize inclusivity and transparency in the review process. A participatory approach ensures that diverse perspectives are considered, fostering the development of effective and equitable tobacco control policies that resonate with the needs of all Kenyans. Currently, we are having around 3 people dying every hour because of cancer, and 3 out of 10 deaths related to cancer is directly linked to tobacco.
Our call number 3, counteraction against tobacco industry influence. We remain vigilant against the undue influence of the tobacco industry in shaping policy agendas. It is imperative to safeguard the integrity of the review process and prevent any form of interference that may compromise public health objectives in favor of commercial interests. Article 5.3 of the WHO FCTC offers guidelines to ensure that efforts to protect tobacco control from commercial and other vested interests of the tobacco industry are comprehensive and effective. Our call number 4, transparency on operationalization of the Solatium Fund. We demand transparency regarding the operationalization of the Solatium Fund. which was established to assist in funding national programs for cessation and rehabilitation, as well as capital and ongoing expenses related to research, documentation, and informational distribution on tobacco and tobacco products. To guarantee that the fund fulfills its intended role and aids in tobacco control initiatives, certain regulations and supervision procedures are necessary.
On to call number 5, demonstration of collaboration and shared vision. Through our collective action, we underscore our commitment to a shared vision of a tobacco-free Kenya. By uniting as tobacco control advocates, we amplify our impact, demonstrating the strength of collaboration in advancing public health agendas and safeguarding the well-being of our communities. As we embark on the pivotal journey towards strengthening tobacco control measures in Kenya, we call upon all stakeholders, including government agencies, civil societies organizations, healthcare professionals, and the public, to join hands in the noble endeavor. Together, we can create a future where tobacco-related diseases are relegated to the annal of history, and the health and well-being of all Kenyans are prioritized.